Hello there, Dr. Brian McKay, not just a chiropractor, staff for Darien, North Buchanan. And again, we're going to apologize for the name. Been doing this podcast for many years now, so I really find it difficult to rename it. So just deal with it. All right, what I want to talk to you today about is obviously back pain is going to be something I'll talk about till the cows come home. But as far as it relates for today, what I want to talk about is failed back surgery. And they call it FBSS, so failed back surgery syndrome. Just to let you know, 30-40% of people with spinal surgery the surgery fails to address the neurological issues that cause the chronic spinal pain to begin with. So that's a pretty scary number. If you go in and the doctor says, well, we got a 60%, maybe a 70% chance. Yeah, well, I guess if you have 60 and 70% chance of getting relief, that may just be something for you. And then you're probably not listening to this. But chronic pain is often not just a tissue issue. And listen, I've been guilty of it. I think most practitioners are guilty. You come in, the patient points to where the pain is, and you tend to focus on it as well. But is that the only part? And as I learn more and more about pain, chronic pain is a brain problem. It's not a tissue problem. Pain is modulated in the brain. And that's something we've really got to address because, listen, I'm happy when a patient gets out of pain. It really does. But let's get back to the brain itself and how it works. All right, the cortex, that's the master perceiver of back pain. That's the stuff that surrounds your skull. Okay, you got all the different parts up there in the cerebral cortex. But let's talk about the cortex is the brain's highest processing center. So a lot of information will come up from the spinal cord, peripheral nerves, to the spinal cord, to the brain stem, and then up to the cortex for processing, higher processing. And then what will happen is that information gets sorted out to other parts of the brain where it needs to go. So the final pain experience is going to be in the cortex. Okay, as the cortex receives the threat signals, it decides how much pain should this person feel right now. Is it minor pain? Well, minor pain, you can pop an Advil, it goes away, and you're good to go, off to work, back to the gym. I want to say yada, yada, but I won't, but I did. Sorry. So that's something to think about, okay? That's where pain lives, in your cerebral cortex, okay? That's where it gets processed. Now, with the right information, some of that information, the pain signals, can be inhibited in the brain itself as well. So if someone goes through back surgery and they're the 30-40% that were failed or have the failed back surgery syndrome, what else can they do to help these people? I mean, I've seen so many people go for surgery for different conditions and not get the relief they would like or get back to living a life they'd lead prior to surgery. It leaves quite a lot of work to be done. And I'm going to tell you one thing, there's not one particular thing that's going to solve it. I'd like to say it's chiropractic. It's not. It's not PT alone. It's not just surgery alone. There's this inherent flaw in the system. And I think it's partially because you're not recognizing, well, listen, as doctors, we're not recognizing the importance. We're going to give the patient what they want. Patient's happy. We get paid. Everyone moves on. So again, let's just look at the three levels of pain neurology. Cortex, master perceiver of pain. Highest center of where the brain assesses the damage and then sends a pain signal down so you act. And like I said earlier, minor aches and pains, Advil goes away, you're good to go, off to the races. Let's go to the brainstem. The brainstem is an area I've been enamored with for quite a long time now because I think a significant number of headaches are treated that way. And it's not about headaches today, but really by relieving pressure in the brainstem, you're going to help with a lot of headaches. Again, what happens in the brainstem is you have a lot of neurotransmitters are made in the brainstem. And it's like if you take your hand, rub it to the back of your head, kind of there's a little bump, and below the bump is kind of where your brainstem is. Not kind of, it's where it really is. So the brainstem is where pain signals are either amplified or inhibited. So a dysregulated brainstem or a brainstem that's clogged up, and this is where chiropractic adjustment comes in. Take tension out of the brainstem, It's like a clogged pipe. You free it up, and away the problems go. But what'll happen there is it has the brainstem can turn the pain value up, or it can make them feel catastrophic. And this is what we call central sensitization in action. So saying it 3 times fast. Central sensitization is one of these brain phenomena, but chronic pain only makes the pain worse. And also it affects your frontal lobe, but I won't go into the other neurological components right now, but they're also important. So the spinal cord is not a passive relay. So that's the third level of pain neurology. It gates and modulates and amplifies incoming signals. So what happens is these signals go into the spinal cord, the place called the dorsal root ganglia, and then they're sent up to different centers in the brain. Okay. Again, anterior cingulate gyrus, hippocampus, frontal lobe, somatosensory cortex, primary cortexes. So it's all relays. It'll all go up to the cortex, which then send the signal down. So what happens is, there's a lot of different types of pain in the body. Well, actually, I'm sorry. Only 2 nerves deal with types of pain. You have A delta and C fibers. One's myelinated, which means it's faster. The unmyelinated C fibers are the type of fibers that do more diffuse type of pain. But what we're trying to get a point across is chronic pain is very much a central nervous system processing problem, not just a tissue problem. Yes, you have the problem in the tissue. That signal goes to the brain and it gets amplified, especially if it's not treated properly. And where failed back surgery comes in is it's not the only way to address pain. All right, listen, if surgery works, you're not having this conversation, wonderful. But think about the number of surgeries and people whose lives have been altered. And I see it, and it really bothers me because, I'd like to think as a chiropractor I can help everybody, but the truth is I can't. But it doesn't mean I stop trying. But the more and more studying I do, the more I see you have to have ways of getting through, through the brainstem to the cortex to fully address it. And these are some types of simple exercises. A lot of different therapies out there. Like, one thing I'd really would recommend strongly is if someone's in chronic pain and you don't want to see a chiropractor, which is okay. A lot of people don't want to. I would suggest strongly that you get to a good acupuncturist to help bring about better balance between the sympathetic nervous system and the parasympathetic. I hesitate to get too wordy with it because I really want it to be understood. But the autonomic nervous system is made up of 2 things. Maybe if you just think of it as the yin and the yang. Well, parasympathetic is the rest of repair. Sympathetic is the fight or flight. So the rest of repair is where you want to spend most of your time, and your body operates. It's kind of like a car that just runs perfect every time. And then all of a sudden, you have the sympathetic, which is like, the gas is on all the time, or the gas is not on enough. So it's there's a balance there, and your life is better off lived primarily in the parasympathetic part of the autonomic nervous system. And I think acupuncture can help tremendously to bring that about, but doesn't mean that you can't do some things like more mindful exercises or breathing type of exercises as well to help bring it back more of parasympathetic dominance. Okay, and let's taking it back. There's a number of different therapies out there that can help with that. You can stimulate parts of the ear to stimulate parasympathetic dominance. But again, the people who have this, chronic pain, especially after surgery, you got to keep searching. I don't think there's going to be one particular thing that's going to address it. Again, if there is, okay, if the one thing being surgery didn't address it, well, perhaps you need to start looking elsewhere, an alternative field, because medicine today, big pharma, they just, listen, take this pill, it's going to go away. Got all your answers. You hope and you pray. And if it does, again, you're happy. Situation solved in your eyes. But these chronic pain is a huge problem in this country because I think it's mismanaged an awful lot because the big pharma solution is the one you got to take. It's what the TV says. Ask your doctor for X. You go to your doctor for X. And guess what? And again, we want things to work for you. We want you. It's actually it's really important that any patient gets what they want. It's not what the doctor wants, what the patient wants. Ideally to be healthy is great, but the number of different treatments out there nowadays, today, that can make that kind of a difference are out there. Like one of the things is if I see someone with failed back surgery, of course, spinal decompression. Chiropractic, if you have surgery on an area, especially if they put a cage in, screws and stuff, you're really not a chiropractic patient at that point. I hope my chiropractic colleagues don't shoot me this. Yes, it's important to get adjusted, but probably not where you have hardware in the body. I mean, around it safely. I think it's important that you operate in a safe, effective mode. But I prefer, that's the area I think you get the best results. But what I want to emphasize here is the idea of there's multiple therapies, either oxygen therapy. That's another one to stimulate the frontal lobe. Because the frontal lobe is really part of that cortex, very much mentioned earlier, with some of the different parts in the brain that modulate pain. And chronic pain will affect the frontal lobe. It's really easy to get depression, brain fog, irritability, all kinds of stuff like that. But I would encourage anybody with chronic long-term pain, seek out. But I think sometimes if you're stuck in right field, look out in left field, and that's where you might find some help. But don't stop searching, because there could be help out there. And it may not be conventional, and it may not be something you read online. Sometimes it's searching, sometimes it's finding the right practitioner that puts you in the right direction. Like I said earlier, as a chiropractor, we don't fix everything. And one treatment doesn't do it all, regardless of what your chiropractor says. But what I want you to think about is step out of your comfort zone and start searching for alternatives that may just make a difference. But don't not think that the brain's not involved with chronic pain, because it really is. It can have a profound effect if you can address that, and minimizing your pain and addressing quality of life issues that you may be lacking, especially after failed back surgery syndrome. I'm Dr. Brian McKay, not just a chiropractor. Hope you learned a little bit about this. Of course, if you have any questions, feel free. I'm available to take your call. 203-656-3636. 203-656-3636. Have a great day, and I'm off to the gym. Have a good one.